What is HPV and how is it contracted?
So it's a virus and it's sexually transmitted. It's really common, very, very common. And a lot of women will be exposed to this virus and their body will pass the virus, will shed off the virus, and they won't have any problems from it. But then there are some strains of the virus that can cause problems.
Now, so when you get a Pap test, should you also be getting an HPV test, or is the Pap test actually screening for HPV?
So the Pap test actually looks for any abnormal cells. In the 20s, so when you're in your 20s, typically a Pap is ordered and it's called a Pap with reflex. So that means is that if the Pap is not normal, then we test for HPV. Once you hit the 30s, normally it's both. Both orders, like both studies, are being done at the same time.
Okay. Now, we mentioned the Pap test can also detect for STDs, and we're going to talk about that a little later. But why is it that HPV is so misunderstood? I mean, I feel like sometimes you go into your office, this is a term that it's very common, obviously, but I feel like it's been more in the news and we've been hearing about it more. We have the HPV vaccine, but why is it misunderstood?
I think that beforehand, years and years ago, it didn't really have the fame of some of the other sexually transmitted infections that we would hear about, like chlamydia, gonorrhea, or syphilis or HIV. And it's a very, very common virus. I think that that's why it's kind of been misunderstood. And then it's just been, in more recent times that we know that it causes cervical cancer, and then they developed the vaccine. And
now, can it go away on its own?
Yes, it can. It can. You could shed it and you may never know that you had it. It's very common.